Hi, I'm Dr. Makin, founder of the Health and Wellness Institute of Utah. In this clip, I'm going to be talking about how often you might need chiropractic care.
Here's what you'll learn. There are two types of conditions, acute and chronic. There are 3 phases of care, and we're also going to share how many visits you can expect depending on what phase you're in. First of all, let's talk about the 2 types of conditions, acute and chronic. An acute condition is a fast onset of a problem or injury, like an ankle sprain. Typically, more visits are going to be required up front to help get rid of the pain, decrease the damage to the injury, and start the healing. But typically, acute injuries will heal quickly. So you're looking at more visits up front, but maybe not quite as long term as with a chronic problem. Now, a chronic problem is a gradual onset of a problem or injury, like arthritis. Typically, chronic problems are a little bit slower to respond and require longer treatment plans. A good example of this is chronic back pain, a very common problem. Many patients come in with back pain that they've had for several years. Those patients will respond very favorably, but you can't expect it to respond overnight when it's been there for several years. Now let's talk about the 3 phases of care. Phase 1 is symptom relief. First of all, we want to get you feeling good and get rid of the symptoms. Once we've done that, that doesn't necessarily mean we've fixed the problem, it just means we've taken care of the symptoms. So then we want to move on to phase 2, which is correcting the problem. Once we've accomplished phase 2 and corrected the problem and everything's working properly, we want to maintain all of the healing and the accomplishment that we have made over the last treatment plan. So a maintenance plan is usually about 4 to 6 weeks, and it's basically coming in whether you're in pain or not to make sure that everything's working properly, that the problem is staying corrected, and that you're preventing further injury. Studies have shown that maintenance care is really a key to successful treatment, and patients or the public will save more time and money in the long run by regular maintenance visits than waiting till they have a problem and then trying to fix it. Okay, so let's talk about how many visits you can expect. In phase 1, which is symptom relief, you're looking at about 1 to 3 visits a week for a few weeks. Okay, obviously that's going to depend on how severe your problem and injury is, but you can expect to see the doctor a couple times a week for a few weeks until you get out of pain. Once you're out of pain, you're going to move on to correcting the problem, making sure that everything's healing up and working properly. Okay, you may stay at the same number of visits as with symptom relief or phase 1. You may be able to slow down to 1 visit every couple weeks. It just depends on how your body responds and what the doctor recommends. Okay, once you've corrected the problem and ready to move on to phase 3, you're looking at typically once every 4 to 6 weeks. Some patients actually like to come in more than that. Some typically like to stay in that 4 to 6 range. The bottom line is every practitioner will give a treatment plan that they feel is best for your body. That's the conclusion of this presentation. Thank you so much for joining us. We hope that we shared something of value and that you learned something. If you have any further questions, or if we can help you specifically in our clinic, please give us a call at 801-709-9797, or you can check out our website with the information here. Thank you and good luck and God bless.